An honor to be here. I'm grateful to Dr. Manoj sir, Dr. Purvi ma'am, as well as Dr. Banshi sir for this phenomenal event and this opportunity to be here. So I'm going to be talking more on practical utility of things, right? The actual usage of AI. So when you open a chat GPT or Gemini or any of the AI tools, you basically interact with it. And as how beautifully in our previous sessions, Dr. Alok and Dr. Shambhu mentioned, what we input the information is what really defines on what actual output AI can generate for you. So as he rightly said, if you put the wrong context, it can give wrong kind of things such as 1300 EGFR. Yes, so just in this line, let me check if this is working. Yep, perfect. All right, so these are my disclosure for the session. There's no, none of the products have been endorsed throughout, across the entire session. We don't have anything to disclose. Not one, but multiple 10 plus AI tools have been utilized to build this content where the source is original. The visual aesthetics have been used by these many tools for this presentation, which is going to be the next 10 to 12 minutes. Now let me thank the team again for this beautiful conversational topic. Let me start. Why should we talk about AI in healthcare now? Because 40.5% CAGR is the annual projected growth of AI in the whole healthcare sector, year on year. 86% of healthcare organizations will be using some or other form of artificial intelligence into their mainstream flow in next 2 years. Competency gap has always been a challenge. It will be keep on happening. And the national mandate, even the Niti Aayog's guidelines, the latest ones, are proactive towards a faster and more ethical and efficient adoption of AI in healthcare. So let me start with hands-on prompting, but before I begin, let me introduce the topic. What does a prompt mean? Prompt is a specific interaction feed which you give to an AI bot, like how you see in the picture, to get you a desired result. Prompting is the act of giving a specific input or instruction to an AI model to generate a desired response, and prompt engineering is a field which is involving process of designing these kind of inputs to give AI to achieve a desired, more accurate and relevant outcome or results. So as Dr. Alok mentioned, it's like 15 lakhs he mentioned per month. But friends, let me tell you, the latest packages have gone even up to 20 to 35 lakhs per month for a good prompt engineer. And in US, it's gone more than 20 lakh US dollars per annum. That's what we are talking about. So this is the trajectory of the importance on communicating to the AI. So I'm sure you would have seen this movie. When you try asking something illogical to ChatGPT or any bot, hoping that it answers everything, this is what it's actually doing. Yes? Kehna kya chahte ho? That's what AI is thinking. So to make sure that AI understands you well, this is a framework which we have adopted, which is called the CRISP framework. Very important. I'm going to request everyone to take a picture of this. So CRISP, C stands for context. Put the right context when you are communicating with an AI. Let that AI message be a wholesome message, where section that message or that chat what you're typing into the AI bot into this CRISP framework. Type what context you want to talk about. Be very specific about patient demographics, relevant history, what you want to understand a scientific query of. Allocate a role to an AI. So I'll give an example. If you tell an AI that you are a finance manager and help me solve a finance query, the kind of output you get is going to be different than telling an AI that you are you're basically a banker. Why? Because if you tell it a banker, it will think like a banker. If you tell you're a finance advisor, it will think like an. I'll give a simple example. Recently I was planning to make a shift over of a car. I was planning to shift from an EV car to a non-EV car to an EV car. So I just mentioned the quote as 22 lakhs is the cost of the car. I want to make sure that my EMIs don't go up, but EMI badne bhi nahi chahiye, and I don't want to put my money at the go 22 lakhs. What's the solution? Can you guess what solution it gave me? So first I allocated the role of an AI as a finance advisor. The second I did as a banker. When I gave role of in the message, when I messaged that you are a finance planner and advisor, it gave me that, boss, for your old car you are getting 8 lakhs. You put that 8 lakhs into systemic withdrawal plan. What's a systemic withdrawal plan? You put 8 lakhs into a fund and every month you get certain amount of, maybe whatever amount, 8 lakhs डाला तो 8,000 आया, 10,000 आया, and the remaining amount you get a loan. The same query, when I allocated role to the AI chatbot as a banker, it said no, you get a 22 lakhs loan because it's thinking like a banker. So who do I rely upon? Obviously the financial advisor. So the same AI chatbot, same context of the conversation but different roles. So be very specific. So if you are putting an oncology query, you have to type that think like an oncologist, not like a psychologist or a layman. Yes, you need to define a role. The third aspect of the CRISP framework is input. Very important. I'm going to show you live scenarios why these things are important, because once you start using AI, if you follow this thing, trust me friends, you're going to be amazed by the intelligence it has. Input system, symptoms, lab values, clinical findings in a very structured way. Give it a structure, like what's the response you want it from? Do you want it as a 500 words article? Do you want it as say 35 points? Do you want it as a content to speak? Do you want it as a content to be spoken to a common man? Very, very specific. जो output AI देगा, उसका format क्या चाहिए आपको? Very important to be defined under the conduit of structure, and give it a purpose. ये जो भी आप chat करके उसको बात करो, what's the end goal? What's that purpose you want to achieve? What's that goal? Are you looking to diagnose something? Are you looking to educate someone? Are you planning to create a treatment protocol? Define it. Very, very important. So friends, you will be thinking, itni sari mehnat karni padi? Yes, because then only you can get the best out of AI when you're using for healthcare, specific, right? Now, let's apply this CRISP framework. Why? Because this framework was originally developed by an entity called Colo AI, and there was some phenomenal work. If you use the structured CRISP framework, not only your accuracy improves, but the guideline adoption, whatever it picks scientific information, that is accurate. It does not hallucinate. वो गप्पेबाजी नहीं करता है. It doesn't give fake DOI numbers. It doesn't give fake responses. It's very specific. Yes. Documentation time also is reduced because the query you put it is the right one. Yes. Now let's move into the application of CRISP framework with the real examples. Let me take you. So this is how a chat window would open. How many of you have used ChatGPT? I'm sure all of us. Yes. This is how a typical chat window looks. So let me give an example. क्या करना क्या नहीं करना. So of the CRISP framework what we discussed, when you apply the CRISP framework, be very specific. An unclear request is something, tell me about diabetes issue. Very vague. Rather than that, list common symptoms of hypoglycemia in type 1, in type 2, be specific, what do you want? Contextualize the whole thing, what should be monitored for diabetes, very vague thing. Be specific, what to monitor in, let's say you're looking at a 30-year-old patient, 75-year-old patient of type 2 diabetes, monogenic, whatever may be the case, with history of hypoglycemia or history of rebound hypoglycemia or whatever you want to add, but be clear. Define the desired output as we see. Let me give an example. Give me advice on insulin, very vague. Be very specific. Provide a step-by-step plan for adjusting a co-formulation insulin dosage. Be very specific. You want an NPH-based formulation ka idea, you want a human insulin, what do you want? Be specific. Incorporate evidence-based practice. What's the best HbA1c value? This can be the most nonsensical post given to an AI. Rather be specific what guideline information you want. You want it from an ADA guideline, you want it from an RSSDI guideline, what do you really need? You want it from South Asia Pacific guidelines. So this is very important. So this is the core difference between a general prompt and a CRISP format utilized form. So let me give one more, I'll showcase you 5 different scenarios just to give you an insight, because this will open your mind to start using AI in a very different way. So the first thing is, tell me about an elderly cardiac patient with comorbidities. Right? This is a general query we have put in. Same query, if you put it as a more specific defining age, 65-year-old female patients with medical history, including relevant comorbidities, also mention current medications. Let's say the person is on lisinopril, atorvastatin, and possible reasons for hospitalization. Now this, you are putting the same thing. First line है उसी का ये है, but थोड़ी कहानी बड़ी है. Little more detail you've done it, because you are applying here context. 65-year-old person, you are asking, you are allocating a role to an AI. You're telling the AI that you have to think for the hospitalization perspective. You're mentioning the medical history with the medications. You're giving it a structure because you want a summary, and you're giving the purpose. Purpose is to provide a concise overview from the clinical perspective of a patient's case. Yes? So again, what causes chest pain? A very irrelevant question to be asked to an AI. Again, differential diagnosis for whatever age you want to put in. With substernal, define where the chest pain is happening, whether it's radiating or non-radiating, accompanied by dyspnea or diaphoresis or whatever may be the case. A negative high sensitivity for troponin, even for that, if you're more specific, whether it's at 0 to 3 hours or 3 to 6 hours or 6 to 10 hours, be specific, because specific is terrific in AI, specifically in AI. So if you again break down as crisp context, you can see here, right? Everything is broken down, right? Symptom-based query, what can I do for cough management? A very laymanish context to be put to an AI. Be very specific, define the age, define the criteria. You're looking at an URTI suspicion or you're looking like an LRTI suspicion, whatever may be the case, right? Again, another one I'll give you for a fever in infant, very non-specific. Infant is only an age bracket, you're defining it. Uske bina kuch bhi nahi ho raha hai. So again, be very specific, give a specific month time, trust me friends, it will pick in and go into all international pediatrics guidelines and pick you the right information if you're defining it properly. If you're giving it a history of, duration of history, 4 day or 5 day or 7 days, it will look at all these specific aspects. So just few examples to open your minds. Another one is of hypertension in mid-age, right? Stage 2 hypertension, defining it, whether the person has diabetes or is a non-diabetic, whether you want to let it adhere to an AHA, ACC guideline, any specific year, say 2017, 2024, 25, define it, define the question properly to get a desired answer. So let me go towards the end of my session with 5 important do's when you are doing medical prompting, when you are doing for a medical query or medical research. Do specify your role and expertise. Do include as many numerical values relevant to your question in the question. Do request the rationale. Give it a chain of thought. You can ask it to think in a staged manner. Yes? Do specify guidelines or protocols you want it to follow or think of. And most important, do include regional and patient context. Because without that, you will get all stupid cutoffs. You will get BMI of 25 if you don't define that the patient is a Southeast Asian or rather Asian Indian phenotype. Because our BMIs are not 25, it's 23. That's the cutoff we want to achieve for our patients. So defining that's very critical. 5 don'ts, very, very important. Kya nahi karna hai when you're talking to an AI chatbot? Don't use vague or ambiguous language. Don't skip relevant negatives, very, very important. So if it's a non-radiating pain, mention it's a non-radiating pain. Don't think AI samajh lega ki nahi maine pain dala wo radiating hai or non-radiating. It won't understand. Don't accept the first output what AI gives without validating it. Why? Because if you accept the first output and if that first output is wrong, AI will form its own chain of thoughts that what I have answered is correct, and it will keep on answering all wrong questions for the consequent 6 or 7 interactions you make with it. Ultimately 15-20 minutes waste हुए and you will say AI कुछ काम का नहीं है. Well, काम का AI नहीं है, काम का हमारा prompting गलत है. The way we are talking to it is wrong. Don't forget key contraindications when you're mentioning it. So this is very interesting. Suggest best treatment for allergy in CKD. Well, be specific. Best treatment considering CKD stage 3B. What if it gives a treatment and it's irrelevant to a CKD case? Be very specific. So don't forget contraindications when you're putting any medical query. Don't use undefined abbreviations like MS patient. MS क्या होता है? It may be multiple sclerosis for us, but for AI it could also mean Microsoft salesman. How do you know it? You don't. So be very specific. Don't use jargons, right? Yes, thoda mehnat padega, but it's very worth it. It's amazing. So my last take home messages: adopt the CRISP framework, specify the role, context, and guidelines. Use chain of thought. Create templates with AI, and remember, AI augments, it does not replace. It only replaces if you are not educated on how to talk to AI. Then it's going to replace you. A last slide, you can all take a picture of it. This is like a simplified slide of the entire last 15 minutes of my conversation. Yes. And yep, with this I would like to end the session with a positive quote. The illiterate of 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. Said none other than by Alvin Toffler. And yeah, would like to take any other questions. Thank you so much.